Public Health Director for the Monroe County Health Department. Good morning, Jill.
Good morning.
How was your drive in today under this beautiful sunshine chemtrail day?
Yes. Enjoying the sunshine for sure.
You know what chemtrails are?
I do not.
Okay. That's
another story.
That's another story for another time. Yeah, it sure is. At any rate, thank you so much for coming in. We're happy to have you. What is the latest as far as COVID is concerned?
Sure. Well, I'm glad to be here, first of all, because it's been, what, Randy, almost 3 years probably? Pre-pandemic, you know.
Yeah, she wasn't allowed to be live because of COVID.
Yeah, we were, we've been pretty busy for the past couple of years now, actually. It's hard to believe we're starting year 3 of the pandemic. But fortunately, over the past few weeks, things are starting to slow down some, which is a great thing for all of us. We're kind of entering a new phase, if you will, of the pandemic. The CDC, the Centers for Disease Control, is looking at numbers in a different fashion and how to measure, the levels in the community. Everybody's always concerned about, well, how many cases did we have today? How many cases did we have today? And about a year ago, 6 months to a year ago, that was important. But now the focus has changed a little bit. So it's not only about number of cases, but what are those cases doing to our healthcare system? So we're looking at what's called a community level measure now. The Centers for Disease Control is measuring rates of cases in a community in addition to your hospital capacity, how many hospital admissions you have related to COVID-19, and do you have enough healthcare staff, to take care of those cases. So that's where we're at now. You can have 30 cases a day, but if your hospital's not overrun, it's not that big of a deal.
Well, how is it now?
Right now, we are in what's considered the low level. So the CDC measures this on 3 levels, depending on your rates and what your hospital data is doing. We're in the low level for Monroe County. And basically what that means is, obviously in each level, you want to stay up to date with your COVID vaccinations. But for the low level, it's just targeted mask use indoors if you are immunosuppressed or, if you feel comfortable wearing that. But for the most part, it's good to be in the low level. It's the green. We always want to be in green. So over the past couple of weeks, we've experienced considerable low numbers of cases in Monroe County. I think last week our total number for the whole week was maybe 9 or 10 for the whole week.
9 or 10 people with COVID?
Confirmed laboratory cases, yeah. So another thing, too, when you look at confirmed cases, it doesn't capture those at-home tests. Now, at-home tests are readily available. You can purchase those over the counter. You can order them free online. So those are not reported to health departments. The only cases that are reported to us are laboratory confirmed cases. So when you say we've had 2 cases, it really doesn't capture what we're looking at.
Now, so you send, what do? Test them and then send that into a lab somewhere?
Yeah, we do not do testing at the health department. The primary care providers do those at the hospital, your primary care provider, or some pharmacies offer testing. So either if it's a PCR test, which is what's called a send-off test, that is sent to a laboratory, such as LabCorp, one of your larger labs.
And where is it? Nashville?
LabCorp, it's all over. Yeah, there's Louisville. Yeah, there's a lot of LabCorps. And there's other laboratories too, not just that one. But then you can have what's called a rapid test. So some physicians and pharmacies can test in their office, and you'll get the results, within 5 to 10 minutes. And then they are required by law to report that positive result, to the local health department.
Are they pretty accurate?
Yeah, for the most part. I mean, the PCR, the send-off, is going to be your most accurate. But, the rapids have been...
I was going to ask that, between the rapid and the PCR, have we had any cases where the rapid shows negative, but maybe the PCR did show positive?
I'm sure that's happened considerable. Yeah, I'm sure. But the PCR, is the most accurate, so we would go with that result.
Okay, talking about the vaccine, okay, like if I've got the vaccine in my system right now, and if I went and had a PCR test or whatever, would it show that I had COVID in my system or show antibodies?
No, no. The PCR is acute infection, or if you've had,
Okay.
the actual virus within. Sometimes those PCRs can be detectable up to 6 weeks after infection. So it's going to show the actual virus in your body. The vaccine, right now, there's no confirmatory antibody tests per se that show immunity from vaccination. That there's not really anything that can show that, but it can show active immunity, which if you've actually had COVID-19, you can show antibodies.
Okay, yeah, that's basically what I was asking, was the antibodies test is actually for somebody that's actually had COVID at one time, and the vaccine's not going to show that then.
Right.
Okay.
So are you counting deaths as well?
We do. Those are controlled at the State Department for Public Health level. There's a committee up there that reviews every death that's reported, either by a hospital, a coroner, a long-term care facility. It's a long process that they go through to review medical records, and before they say this is a COVID-related death. But once they do determine that it was a COVID-related death, then they will let the county know that they are reporting that out. And so far to date, and this is since the beginning of the pandemic, we've had a total of 74 deaths in Monroe County, COVID-related deaths.
Since COVID started?
Since the beginning of the pandemic.
Wow.
Yes.
So where does that sit with the rest of...
That puts us in a pretty high incidence rate compared to our population. Now it has slowed off a little bit, but like about a year ago, we were a really high percentage of deaths for our population. I don't know what it is today, at 74, but
what would be the reasoning for that? Does anybody know?
The reasoning
for the deaths, the high percentage of deaths per population.
Well, we've had a lot of elderly, immunosuppressed people, unvaccinated. There's been some deaths in our unvaccinated population. If you have other comorbidities along with COVID, your risk of death are a lot higher than a healthy person, who gets COVID.
Now in Kentucky, you said we was in the green. How is the rest of Kentucky?
Most of the state is gradually turning. It's green, orange, and red are the colors that they are using. There's several green counties. There's a lot of orange, but we still have some red. But every week it gets a little bit better, and that's only measured on a weekly basis. The CDC looks at those numbers, I believe, on Thursdays, and then Fridays you'll see it change. So every Friday is when you need to go and check out the map and the colors.
And that's based on population too, then.
Yes.
Right?
So this past Friday, I was very pleased to see that we had moved to the green color. But there are still some red counties in the state.
What do you do with that information? Where do you send it?
Well, the state keeps all of that information. The Department for Public Health, that's data that they keep for the whole state as a whole. We don't calculate data at the local level. Now, we do collect case numbers and death totals, but as far as incidence rates and things like that, that's not calculated at the local level. We have that information available on our website for folks to go and check out, and then also the Kentucky Department for Public Health website has all the data available.
Are they breaking it down into age groups also, and
yeah,
like,
you can get quite a bit of information from the state's website as far as ages and positives, death,
male,
ages.
female? Do they do that too? I guess.
Yeah.
Probably, so. All right, let's take a break, Mike, and we'll be right back with more Monroe Monday.
All right, this little blinky button, buddy. Okay, we're right back here with the Public Health Director, Jill Ford of Monroe County Health Department. We're talking about COVID and the other, everything to do with COVID. Everything to do.
That's been our lives for
A
quite
couple
some
of
time
years.
now, hasn't
It sure has. Has anybody down at the health department gotten COVID?
I've known quite a bit of colleagues, friends, family, that have tested positive for COVID. So definitely no one is, immune to that.
Exactly, yeah.
But, when I mentioned a few minutes ago about entering a new phase of the pandemic, there are still times that we still need to take extra precautions, and that is if you do test positive for COVID-19 or if you're experiencing symptoms, if you've been exposed to someone with COVID-19, there's still some extra precautions there that you need to take, such as isolating, quarantine, wearing a mask. So that stuff has not changed. So we still need to do that. But now we have a lot of effective things out there that can help us, such as vaccinations. There's effective treatments now. So those tools, are our strong suits at this time. And as far as COVID-19 vaccinations go, those are still readily available. They are at no cost to anyone that chooses to get one. We do have vaccines at the health department. Right now we are doing our COVID vaccine clinics on Wednesdays. But there's several places in the community where you can go and get a COVID vaccine. Check with your primary care provider. Some primary care providers do carry that. There's several pharmacies in town.
So only Wednesday is the day you do it at the health
We are
department?
doing those on Wednesdays right now, yes. And because there's so many other places that you can walk into some pharmacies 7 days a week,
right,
and get those. So we have Moderna is the brand that we are carrying, and then we also have the pediatric Pfizer vaccine. I do believe we are the only provider in the community that has the pediatric Pfizer, and that's for ages 5 to 11 years of age. So if you've been thinking about getting one, or maybe you need your booster, I'd like to encourage you to do so. If you have questions about that, you can call us at the health department, speak with one of our nurses.
You have to make an appointment for that Wednesday.
We try to, but if someone walks in on a Wednesday, we're not going to turn them away, obviously. But we are trying to do that by appointment.
Especially if they're coughing and huffing and puffing.
Yeah. And we still offer quite a bit of immunizations at the health department. Flu, we've talked about flu for a while, but flu is still circulating in the community.
How many people have? Do they get misdiagnosed?
There's tests. It's laboratory tests that you either test positive for flu or you don't. So it's pretty easy to diagnose, through a test. But
as opposed to COVID.
Yeah.
Yeah, I guess you could say COVID is a super flu.
I think some primary care providers would test for both. If you present with symptoms that are could be either, they're going to test for both most likely. But as long as flu is still circulating in the community, you can still get a flu vaccine. So we still have flu vaccines available, and of course we carry some adult vaccines. Not a huge inventory of those anymore because again you can get those at most all pharmacies. But we do have a lot of the pediatric vaccines. Our infants and childhood vaccinations.
I've got a question for you, and it's your opinion is what I would like on ivermectin. Does that help? What is
I don't
opinion?
have really a strong opinion one way or the other. The only thing I would say to that is, we have to recommend what science supports and what the studies support, and that's not an FDA approved or a people can do what they want to do. People make their own decisions, but from a healthcare standpoint, we would not recommend that because there are no studies to support it.
Now, you was talking about the COVID, flu. What about like pneumonia and shingles?
Mm-hmm.
Do y'all have those vaccines?
Right now, we do not. We have the childhood pneumonia vaccine, but the adult brands, you can get those at several pharmacies in town. And so when we get calls about that, we have referral sources in place where we can refer folks to get those vaccines.
As far as other programs that the health department does, what's going on now? Or
our clinical services have pretty much gotten back to normal, and by normal I mean everything's open back up. If you need to make an appointment for an immunization, or we have our WIC program. Now, our WIC program, that's a supplemental nutritional program for pregnant women, infants, and children. It actually is still being conducted through telehealth, if you will, over the telephone, the WIC. And as long as we are in a pandemic and state of emergency, that's a federal program, so those guidelines will be in place. So we are still doing a lot of our WIC services over the phone, but we do physicals, school physicals, sports physicals. We can do family planning. We have a family planning program where women can obtain their pap smears, mammograms if they need it, low-cost birth control if they need that.
So do you have a telephone number where people can call
Sure.
with all of these? Like anything in that
We
basket?
have one number, and it'll get you anything you want. Yeah, that we have.
What would that number be?
270-487-6782.
and they'll direct you in the right.
We will.
You're going to answer, right?
One of my lovely front desk staff will, or one of us will pick up the phone. Yep.
How many people do you have down there?
There are 10 of us total. We have 10 employees at the health department.
And how many departments would there be? You just named off several.
Yes. We have our clinical staff, Amy Comer, Mackenzie Hale, Stacy G, and Amy Botts. So
Wow.
they take care of our clinic. We have our environmentalist, Jason Holland. And then we have health education, Deshelle Thompson. Myself and Dawn Scott. She's our administrative assistant. And then we have our HANDS program, which is a program for moms, first-time parents, or actually you can be multi-gravid parent. They do home visiting services. That's Sarah West and Valerie Copus. So I hope I did not leave anyone out.
My goodness, that's good right there.
There's 10
I'm
of us.
impressed.
So we do a lot. When you think of the health department, you think of it's where you got to get your shots, usually. But we do a lot of behind-the-scenes type programs and things that the community probably, doesn't even realize that we're
Yeah, like
part
you said,
of.
it's just not the immunizations for the kids to get them
Yeah.
to school. It's throughout the whole school system, helping them, at home, and
Yeah.
like you said, the HANDS program and then the WIC program.
And with the pandemic, when it started, when COVID-19 started, it kind of brought local health departments to the forefront. And we've been doing communicable disease investigation for years. I mean, that's what we do, so it's just we haven't worked through a pandemic,
Right.
But we've always been in part of, disease mitigation, the spread, spread and control of disease. So that's just one of our many, many roles we do.
Yeah, I know we've come a long way in the past 2 years because, it was everybody had to wear a mask. And of course, it goes back to this, when they said wear a mask, wash your hands. That was all common sense stuff that should have been done before, and that's where the flu kind of backed off too because people was washing their hands. There was, me and Mike wasn't side by side. We was 6 foot apart, so if I sneezed or something, Mike might not get the flu or whatever.
You're exactly right.
It's the same scenario. But
Infection control, just basic infection control procedures.
I just hope people don't get laxed with that.
Yeah,
Even though COVID is, kind of on its way out, hopefully, and it's going to be just like the flu or pneumonia or anything.
Hopefully, eventually, it's still too early to predict that because it has been so unpredictable with the variants. And that's where it's still to be determined. Will there be a new variant that takes over?
Do you see that happening?
You never know. They're watching other countries now where they have seen some new variants. They have not been as severe as the Delta and Omicron, which are the two.
What are we on, like number 4 maybe?
Yeah, I don't know.
There's so many of them.
That's the thing you worry about with a virus that mutates like this one does. If that's something that can be controlled, then we'll eventually move to what's called an endemic state, which is where it is like flu or pneumonia or any other virus that we just live with,
Well, just like the flu, every year that if you get a flu shot, there's, I don't know, how many flu variants are there?
Yes,
There's,
several.
And they'll say, okay, this is for type A or type B,
Mm-hmm.
type C. That's the most predominant this year, so that's what we're going to focus on.
Correct.
That doesn't mean that flu shot, just because you get a flu, say a type C flu shot, it doesn't mean you're not going to get a type A flu.
Yes.
So.
And that's a good example of an endemic. It's that virus flu is always going to be there, but it's a little bit more predictable,
Right.
as opposed to what we've dealt with COVID-19, which has been very unpredictable.
All right, let's take another quick break, and we'll come back with more Monroe Monday.
With Monroe County Health Department's Public Health Director, Jill Ford. And Jill's given us a heck of a lot of good information on COVID, things that are going on with the health department. One quick thing, too, I'd like to ask, are you guys learning anything about chemical warfare or smallpox or any of the things that are rumored that might be coming down the pipe?
Not right now. A few years ago, when the smallpox kind of resumed again, we had some trainings on administering smallpox vaccination and quite a bit of training, but it just comes in waves, whatever the situation is at the time. Right now, no, to my knowledge, nothing at the local level. Now, what folks are doing at the federal, state Department for Public Health level, I can't answer to that.
Yeah, I
But,
know what. It's not funny, but yet in a way it was. You know, the FDA come out the other day and said, in case of a nuclear attack, to be sure to social distance yourself and wear a mask. And I was like, that's all they're worried about was getting sick during a nuclear attack, you know. But I understand where they're coming from because, you know, if you're in a confined area, you know, and, you know, if you did make it through the nuclear attack, you know, then you still have all the other, like you say, COVID or pneumonia or flu or anything else, you know. But I just thought it was kind of funny if they throw that out there, you know.
We do have it's Kentucky Public Health Emergency Preparedness Program, and they are mainly at the state level, but we do have regional folks that, you know, take care of our county, and they have tons of plans and things that they practice and work on and update and revise, and I'm sure that's all on their radar, you know, but until it gets bad enough to be at the local level, you know, sometimes we're not involved, you know, in the preliminary
now, Michelle, I know she does a lot of training and stuff, and she goes into probably the schools and stuff. And
and again, some of that stuff's just kind of been put on hiatus, you know, until where they were out of school and things. But yes, she does abstinence programs. It's in the schools. She works closely with Monroe County Cares. They do some substance use prevention type things with the kids. She does tobacco prevention, cessation programs, still
vaping
classes.
Vaping is big right now with kids. You know, they're getting away from the cigarettes, but they're getting into the vaping. You know.
Yes, that has been a big issue in our locally.
A lot of programs there. You know, Michelle, all the people at the health department wears a lot of different hats.
Yeah.
You know, so there's a lot of programs, and 270-487-6782.
And we do have a website. It's MonroeCoHealth.com.
Wow.
You can get access to a lot of our programs there and COVID data if you're interested in keeping up with that. We'll put that on there too. Upcoming classes, anything that's going on, pull from our website.
Alrighty. Anything else you'd like to touch on before we cut you loose?
I've got something I'd like to ask you real quick. A lot of times you may have openings. Do you have any openings down there that somebody might call?
As far as employment,
yes.
Not at the current time. We have filled all the open positions that we have had recently.
Where do you get them? Where do you get your candidates? For
website. You have to go to a website probably and fill out a form, or do you actually come to
Yeah, we posted the last two positions that we had were posted on Facebook and in the local newspaper.
Okay.
And we had, you know, quite a lot of applicants and some good ones. So, but the state, the Department for the Personnel Cabinet does have an application system where you would go online, and if anyone's interested in a career in public health, you can go on to the Kentucky Public Health Personnel, and you can see openings in other counties, you know, in other local health departments in other counties, and you would apply online as well.
How many years you been there now? That many, huh?
19, maybe.
Who was before you? Do you remember who
the director?
Yeah.
Yeah, it was Valerie Hudson.
That is right.
Yeah.
That is right. I forgot.
I'm also an RN, so I worked in the clinic for 10 years before I became director. So I've been the director for the past 9 years.
Good for you. All right.
All right, we'll take another break, and we'll be back with more Monroe Monday right here in a minute. Appreciate Jill coming in and everything that the health department does for Monroe County.
Thanks for having me.
Thanks, Jill.